You could eat this, it'll just pass right through you. There's nothing dangerous about this. Interesting. Fascinating. So you can do pain control in the battlefield real quick.
Yes. So when soldiers are evacuated from battle because they're wounded, it's real easy to get to their ears.
Welcome to the Dr. Gill Show. This is where we talk about medical matters that matter to you. My return guest today is Dr. Sue Overkamp. Welcome back to the show, Sue.
I'm just honored and delighted to be here, Gil. Thanks.
What a delight to have you back. For those that don't remember, Sue is at least triple board certified in family medicine, osteopathic manual medicine, and acupuncture, and you probably have a board certification in life and family raising as well.
I feel sorry for the people who would have to administer that board exam.
Yeah, it's a tough one. I mean, you would be one of the chief examiners. For those that don't know, a lot of boards involve a written, first of all, you have to do an approved program. Then you have to have a written test. And then for a lot of these is the oral exam. And for us, for OBGYN especially, you got to fly to Dallas and you go into this place and you're sitting there all nervous like this. And then two people will walk in and it's the chairman of blah, 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 and the author of your textbook, blah, blah, blah. And it's very intimidating. Anyway, a heck of a process. So once one gets boarded, you can be assured that there's at least a basic competence level, and usually it's very, very high. So that's a very impressive, Sue. Sue is also the physician owner of a relatively young practice here in Columbia, Missouri called Door to Door Medicine, and it's getting off the ground and growing, and this is going to be an exciting time for you, Sue.
It really is, Gil. And recently, even more doors are opening up for my practice. So I'm excited about that.
Well, you know, nature abhors a vacuum. And I see you attracting all, when people, when the word gets out about all your talents and all the services you offer, I see tremendous prosperity. So today we're going to talk about one of your skills, acupuncture. Yeah, this is going to be a big one. This is going to be a big one. Yeah. Now, acupuncture has been around a long time. It's my understanding, the legends are that it started somewhere back in China. In China, people getting hit by arrows, and then they were not. Can you help me? Because maybe I'm completely wrong. Would you tell me, where does acupuncture come from? Is there any idea? Enlighten us on the history of acupuncture, please.
That is a great question, and it's a little bit like the question, who discovered America? So I grew up learning that Columbus discovered America, but then, of course, people came over the land bridge from Asia. People came from Northern Europe before that.
Yeah.
So what I'd like to offer is that traditionally we think of acupuncture as coming from China. But then we found a man frozen in the Alps, and he had scars on his body that correspond to acupuncture points.
Oh.
And they were able to determine that those scars were made by thorns. So that
Utsi or something from the valley, from the area of the the Utsi man.
Yes, thank you. I'd forgotten his
years.
name.
Oh yeah, what a fascinating discovery. He also had tattoos. He had a little kit with him for fire starting. He had his arrow, his bow, had an arrowhead in his back. It may have killed him. So the Utsi man, if I'm saying that name correctly, had scars from thorns that could have been some type of acupuncture.
Yes.
Tell me more.
So also the traditional explanation is what you mentioned, that arrow wounds would cause certain types of healing. And so then people started experimenting with, instead of arrows, using smaller implements. And before I go into the next piece, I'd like to mention, if I ask people, what's the most important branch of Chinese medicine, they'll say acupuncture because that's what everybody knows about. It's actually number 4 in the hierarchy.
Tell me the other 3.
There are 3 healing arts that are considered even more potent than acupuncture. And when used together, then you get exponential increases in the chance of healing and wellness. So,
I'm excited to hear.
The first one is called Qi Gong. This
Qi
is
Gong.
the Mandarin pronunciation Qi Gong. Mandarin's a tonal language. So Qi is usually translated in English as energy. But when Westerners hear energy, they think about kinetic energy or electromagnetic energy, potential energy or chemical energy. Okay?
Right.
So Qi is none of those. It's probably best to translate it into English as life force.
Oh.
It is not on the electromagnetic spectrum. We can get readings that are electromagnetic when people work with the Qi, and this was famously done in an experiment at Harvard in the 20th century called the copper wall experiment. And what they did was they got a group that I think was number 8, indigenous healers, and they put them in a room that was entirely copper.
Mm-hmm.
They set them on a stool, insulating the healer from the copper, and then asked them to do their thing. And they were getting big electrical potentials being generated by people working with life force. So people in Africa, indigenous people in Africa use it. Indigenous people in the South Pacific, indigenous people in Northern Asia, in what we now call China, indigenous people in North America. Lots and lots of different indigenous cultures we know worked with life force. The Chinese call it Qi.
They tapped into it. I love that life force concept. Wow. So in a copper box, that's called a Faraday cage. In fact, I have one around in my vest, my high-tech vest. You put your wallet in there and they can't scan your cards.
Oh, haha. Yeah.
So it
Nobody
insulates
can
you from,
steal from you.
Yeah, they can't
cards.
snarf your numbers and information.
Gotcha.
So maybe many cultures have somehow discovered and tapped into this life energy.
Yes. And the Chinese aren't the only ones. But because we're here to talk about acupuncture as it is normally received and spoken about in the U.S. right now, I'll focus on Chinese, except that I also know how to do Japanese acupuncture. But that's a different, it's similar to
and the Chinese will tell you everything in Japan is a ripoff of Chinese stuff. There's some ethno jealousy there.
Lots of history between Japan and China.
But before I forget, let me interrupt you. We talked about the 3 things before that are maybe more powerful than acupuncture. So we talked about the Qi Gong.
Qi Gong.
Qi.
Thank you. Gong. Gong is the same word as Kung in Kung Fu.
Oh, Kung Fu. Gong. Okay.
Gong means discipline, work, art, skill that pays you back. So you devote yourself to it because it's a thing worth doing. And then it pays you back in ways that you can never anticipate. So Qi Gong is working with Qi. So right now I have a ball of Qi between my hands. And anybody who wants to can try this. It's like playing patty cake, but you don't touch. Just see if you get a sense of push-pull between your hands, like you might get with a small magnet. If that isn't quite it for you, then try scanning up your arm with one hand and see if it feels different.
I want to think it does.
So what I'll say is it's subtle, and over time, as you work with it, you learn to manipulate it and store it in your body, dispel stagnant qi from the body, bring in fresh qi, because the whole way acupuncture works, and I still didn't forget about the number 2 and number 3, is that qi is either deficient or stagnant normally if there's illness. I'll take a quick moment to tell a story. In ancient China, if the emperor got sick, they executed the doctor.
Oh,
It was the doctor's job to see imbalance happening way before symptomatology, way before.
Oh my goodness!
Imbalance
that just gave me
in the
chills.
qi. So if the emperor got sick, the doctor was executed, because in a way you could think of acupuncture as wellness medicine. In the West, because we're so disease, illness focused and naming it, diagnosing it, and then treating it, we don't think that way. We go to the doctor when we get sick. In China, you go to the doctor when you're well. Also, in the Vedic tradition, you go to the doctor when you're well so that you can learn how to stay well.
Just 2 comments real quick. I have a particular massage therapist I love very much, and I've had some very good ones. I can feel the life force in his hands when he's doing this. I can tell an inexperienced student who doesn't quite get it with the real, I can feel that life force.
It's not just like pressure.
Yeah, no, there's something else behind it.
And it's not electromagnetic.
And I had a friend
but you can sense it.
Did special massage back in New Jersey. His name is Van Beverend, by the way. Still a friend of mine. And he called it Radiant Touch. That was his name.
Oh, interesting.
For it. You could feel his radiant touch. It's got to be the same idea. And one more thing, I know in India when you're meditating and you've got your fingers together, they don't touch. There's that little space. There's that little space in there where the energy, maybe they're tapping into that force as well. Anyway, I just had to comment on that.
There is a form of Qigong that is just hand mudras.
Hand what?
Mudra.
Mudra.
That is, from the Vedic culture. We use the word mudra because it's understood in the West, but the Qigong is Chinese, but you use hand positions.
And Ayurvedic medicine goes way, way back as well.
Yeah.
So we're tapping into ancient wisdom.
So Qigong is to learn how to move Qi through the body at will for particular purposes. Could be healing, could be wellness, could be martial art, could be all kinds of things. Okay. The second one is diet.
Diet. Does that include the herbs?
Herbs is number 3.
3. So diet, just a more macro kind of concepts.
Just that depending on what the circumstances are for a person, shifts in diet can help rebalance. So how you eat can either balance you or imbalance you.
Okay.
And diet is a potent way to rebalance.
Okay.
And then herbs also potent, acupuncture potent.
Okay.
And then there are other arts, gua sha, tuina, things like that. Okay.
Well, I see more episodes, Sue, as we get into these other things. So after qi and overall diet and herbs, another therapy is acupuncture.
Right.
So what kind of condition? Let's just do a brief overview. What if somebody has here in the West, we have an isolated condition. We know that none of them are truly isolated, but if somebody has something, what would give me like the top conditions somebody were to call you? Maybe they're not as well versed in the words, but they say, hey, I've got blah, blah, blah. Doctor, can you help me? Can you give me some categories, please?
Well, let's talk about neuromusculoskeletal problems because most people seek acupuncture for pain management or pain relief.
All right, there's a top line.
In the U.S. However, it's important to understand that acupuncture, along with the other healing arts that we've mentioned, is really the internal medicine of China. So in the West, we give medications primarily in the practice of internal medicine. In China, anything can be treated with acupuncture. I'm trying to think of something that cannot be treated with acupuncture.
So you name it, there is a potential
name it.
acupuncture intervention or therapy.
Sure.
Wow.
Let's talk about failure for a term maybe to have a vertex presentation.
Oh.
Bladder number 66. Moxa at bladder number 66 on the little toe will turn the baby.
Has potential to turn the baby.
Yeah. So moxa is a branch of herbal medicine where you burn a stick of dried mugwort. It's a particular herb, and you just hold that warmth near the acupuncture point, and it affects the acupuncture point and affects the body.
I've heard of moxibustion.
Moxibustion.
Is that cupping?
Cupping is actually using a cup. Moxibustion is burning mugwort.
Okay.
It's in a stick.
Near that site.
It's dried. It's easy to manage clinically.
Okay.
As opposed to mugwort leaves, which would not be easy to manage clinically. So cupping goes with gua sha and tuina in my mind. Cupping uses, I have little glass cups, and I place them on the patient, usually the back, not always. And then I can evacuate the air so that there's a partial vacuum in there. And that is a detoxifying strategy.
Boy, a whole nother world. So
Yeah.
when people think needles, they think pain.
Right.
So why don't we talk about and you have so thoughtfully brought some examples of these needles. So why don't you tell me what is the actual, just so people, before we get into the conditions treated, if one is getting an acupuncture treatment, I assume there's puncturing, accurately puncturing going on, acupuncture, right? The special little needle. So how does that process work in general, and why doesn't it hurt in general?
I would like to contrast it in order to help people understand. So in the West, a needle is hypodermic, and you're going to inject fluid through a hollow metal tube.
Yeah.
That metal tube is called a needle. It is fine, but it has to be large enough to allow fluid to pass through it from a syringe or to
pull back.
be sucked.
Right,
out.
suck
Yeah.
it out of a vein, right.
So acupuncture needles are not hollow. They are filiform, which means they're hair thin. And whereas a hypodermic is going to pierce tissues, filiform needles usually go between tissues.
Yeah, the tip of a needle you're going to get an injection with, or you're going to have blood drawn with it, is beveled, in fact. It's a little knife.
Right, it's a
little knife. In
It
fact,
is.
you're cutting there. But these are more conical. It's going to a round point, as it were, and it's just pushing the tissue apart.
Yes.
Different animal, different process.
And speaking of Japanese versus Chinese, in my first acupuncture class, the teacher says, "Does anybody have any needles?" I said, "I do." So I gave him my Chinese needles. He said, "What are you using these for?" Japanese needles are so much more comfortable. He's right. I don't use Chinese needles anymore. I do Chinese acupuncture with Japanese needles.
Love it.
Because the way that they go in is so much more comfortable. So, Gil, are you my subject for acupuncture?
I would love to be your subject.
So I am going to use the point in the hand that is affectionately known as the point with 100 indications.
Wow.
And its name, large intestine number 4, is tiger mouth. This is the tiger mouth.
Tiger mouth,
So
okay.
it's here.
I'm all yours.
And so acupuncture points are between things. They're not on top of a bone. They're next to the bone where the muscle is attaching here, for example.
Cut.
So this one is right here. It's
How to
right.
describe- Is that in?
Yeah.
It
you
felt
go.
like pressure,
Yes.
Sue. I felt
I
no
always
pain.
use distraction because when I use distraction, then
Folks, there is a needle, a Japanese needle in my hand, and I really felt nothing. But there's something going on.
there's something going on. So sometimes
Oh.
needles don't hurt at all when I put them in. Frequently, they hurt mildly for 5 to 10 seconds. And occasionally, even if they didn't hurt when I put them in, they really start to hurt as the treatment progresses because chi is blocked and the chi coming in through the needle is unblocking it. That can be uncomfortable until it's unblocked. I have patients remark to me about that all the time. They say, boy, in the middle, it really kind of hurt for about a minute and now it doesn't hurt again. Why is that?
Yeah, I would describe this as just a tiny, maybe an ache.
Slightly.
It's like a slight ache.
Yeah.
And I've got a sore shoulder right now, so maybe this will unblock something. Interesting.
Well, if you have a sore shoulder, when we're finished with this lovely video, I'll do a 1 needle technique for you.
I would love a 1 needle technique because I did a PRP, I did platelet-rich plasma injection with my orthopod. I'm doing soft wave shock treatment with my chiropractor on the shoulder as well. Doing anything I can to keep my my old body functioning at a top level.
Okay, if I take this out now,
Please, I'm
okay.
Yeah.
There you go.
First of all, I didn't even feel it come out.
That's because I pressed it a little bit.
There is zero blood. I thought I'd have to lick or something. No, there is zero blood.
If a patient bleeds, it's because they have damp heat. It's not because we pierced a vessel. Damp heat is a Chinese diagnostic term.
Damp heat.
Yeah. There are only 8 things that could be wrong with you in China.
Ha!
Instead of how many do we have now? Diagnostic.
I don't even I had a neurologist here, and I mentioned Joel and I Joel Schenker, and I asked him about headaches. He said, "Well, how many headaches do you think there are?" I said, "Well, maybe 20, 30." He goes, 326 or whatever it was.
Wow.
Different types of headaches.
Wow.
So that was a tiny needle. It didn't hurt.
By the way, that point, one of the main indications is headache, especially frontal stress headache kind of thing.
Now there's different. So we just showed conclusively this does not hurt. It's nothing to be afraid of. Now there's different types of needles you have there for different parts of the body. Why don't you this is a good time to talk to us about the various needles. Why don't you show them to us and we'll put up some pictures.
So this is a 30 millimeter long needle. It's 3 centimeters long. And it's 0.20 millimeters in diameter.
Millimeters. 0. Wow.
Yeah. And then this little needle is the same diameter. It's just shorter. I use this needle so that it's not top heavy in areas where there's little flesh.
Are you putting that in your scalp right now?
Yes.
You're putting that in. You're demonstrating on yourself.
Yeah. There's my
my
little antenna. My patients say, "Did you remember to take out my antenna?" Because I often needle byway point with that. These are filiform. This is an ASP needle, and it is not a traditional needle. It's used for auriculoacupuncture, and I do not have formal training in auriculoacupuncture specifically.
Okay.
I do have formal training in what's called battlefield acupuncture. This is very
I love that's a sexy topic. Battlefield.
Yeah, this is a very, very new therapy on the acupuncture scene because acupuncture goes back, before the Christian era, thousands of years. This was developed in, I believe, the 1970s or 80s by an MD who was, I believe, a colonel in the Air Force. And he was looking for a way to do instantaneous as possible pain control for injured soldiers on their way to the hospital to get the surgery that they needed or whatever care they needed. And he devised this treatment. And this ASP needle is only that long.
A few millimeters, tiny.
And the little gold button, I'll just get the needle out if I can. There's a little gold button, and behind it is a flange. And this whole thing is just an applicator. So I would use it on a patient ear like this.
You just put that into yourself?
Uh-huh. It's in my ear. Where did it go? Oh, it fell out.
Okay.
Okay. Because I bent it. That's my bad.
Okay,
Pushing it down on the table. But that's the size.
Oh, my goodness.
So that when this is in your ear, only people very close
Looks like
to
a little
you
tack.
will know that you have acupuncture needles in your ears, and you leave the clinic with these in your ears, and they stay in between 2 and 14 days. And to get better pain control, you massage them.
And then do they fall out eventually?
They fall out on their own, and you can still massage those points after they fall out. You can still get pain control, and then when you're not getting so much pain control, you come back in and we reapply needles.
My goodness, I can touch this. I'm going to touch this.
Yeah, a maximum of 5 in each ear.
It looks like a tiny tack, folks, just a few millimeters long with this little button on there. It looks like a tiny tack or a finishing nail, the finest of finishing nails. And it's so small, you could eat this. It would just pass right through. There's nothing dangerous about this. Interesting. Fascinating. So you can do pain control in the battlefield real quick.
Yes. So when soldiers are evacuated from battle because they're wounded, it's real easy to get to their ears.
Sure.
It's not, they're in armor, so it's not so
Right.
easy to get to other parts, but it's easy to get to the ears.
That'll help with some pain.
And Dr. Nemtsov, the man who developed this, asked us not to say that it works any better than 8 times out of 10. In my clinical experience, it's a good 9.5 out of 10 people are helped by this treatment.
That's as good as almost any treatment. When I do surgery for pain, that's what I tell people, about 80-90% chance I'm going to help you.
Yeah. So it's highly effective.
So we can go in the ear. So we've got the tiniest of tacks. You've got these long, tiny, filamentous, hair thickness type needles.
Yes.
That don't hurt for the
So
most part. And do you ever hook them up to electricity? I've seen times
I do. Yes.
So you can even supercharge them with electricity, electromagnetic
energy. I use, milliamperage, and it's a special device and little leads. So
you can clip a little wire on that.
This I put in myself, so I'll do that again.
Okay.
And sorry, it's bent.
Yeah.
There's a little clip that goes on the metal part of the needle.
So we can add electromagnetic energy to that.
Right.
Oh my goodness. So now that we've seen the actual tools, let's talk about the actual conditions.
Yeah.
Somebody can call you up at door-to-door medicine, say, doctor, I have blah, blah, blah. So let's talk about the various conditions you can treat. And I'll let people know they probably come to you for X, and you're aware of Y and Z,
right?
And you're going to treat the whole person, and they're not going to necessarily know all the stuff you're doing.
Yeah, I frequently manipulate people before I put needles in.
Yeah, physically manipulate them.
Yes, right. Osteopathic manual medicine, right? So 50% of people who come to see me have low back pain.
Oh, yeah, it's like the chronic human condition.
50% of people who go to see a family medicine doctor have low back pain.
It's like death, taxes, and lower back pain. Add that to the
so
guarantee of life.
let's use low back pain because that's a great one.
Let's start with low back pain.
So first, I do osteopathic treatment. Then I want to do some pain management because sometimes being treated will initially aggravate a little bit. the patient. Sometimes the pain is just gone, but sometimes it's aggravated. So in this case, I have some choices, and one of my main choices would be to use the 4 gates of pain. The 4 gates of pain, 1, 2, and then there are 2 on the feet near where the great toe and the second toe come
Kind of
together.
an analogous place on your foot.
Analogous on your
So there's
foot
4.
to
So
the
all
hand.
4 of these places are
They're the 4 gates,
Gates
of
of
pain. If you want to do a quick, easy treatment that's going to really reduce pain in almost everyone, you would use those gates.
4 needles, 4 spots, all 4?
4 needles, 4 spots. Right. I would also want to treat the low back. And the meridian that runs through the low back, that's the most efficacious besides the governing meridian, is the bladder meridian. And at each vertebral level, there are not just 2 points. Let me back up.
Back up.
Let me back up about meridians.
What is a meridian, Sue?
Water. Let's talk about water.
Good flow. Be the water.
When water is dammed, it becomes stagnant, right? It can't flow. When you open up those floodgates, and downstream you can have deficiency in water, right? When you open up those floodgates, now there's flow. So acupuncture is allowing flow in a particular direction. We've mapped them. We know where the meridians run. 3 run down the inside of the arm this way. 3 run this way on the extensor surface of the arm, both sides. 3 meridians running down, running up from the feet up to kind of the medial aspect of the torso, and then 3 running down the back and the sides down to the feet. So these are yin meridians.
Yin.
These are yang meridians.
yang.
Coming up from the feet is yin meridians, and coming down from the head is yang meridians. And the anatomical position for acupuncture is this. Qi flows this way and this way. Up from earth, down from heaven is how they speak about it.
Sure, I love analogies.
So down from heaven, up from earth is yin, down from heaven is yang.
Yang.
Yang is sunlight and masculine energy, not limited to males.
Right. Yeah.
Yin energy is cool, earth energy, feminine, not limited to women, to females. Everybody has both kinds. And so these meridians are like little streams. There are 3 streams running this way in this arm right now. This one's a little blocked because that finger's cool. I'm not sure what I need to do about that, but I can tell that when the qi is blocked, sometimes the blood vessels don't work as well either. Anyway, and then 3 this way. So there are points on the meridians that have names, and those are the most efficacious places to either do acupressure, needling, or heat.
Yeah, I've seen these diagrams. It shows the meridians, but there's these spots along them. So those are the best real estate for that part of the meridian.
Correct.
Okay.
So in the low back real estate, we don't just have a channel on each side of the spine in the bladder meridian going down and off the little toe. We have a double channel on each side. So we have 4 points where we can treat problems at a particular vertebral level.
Okay.
So let's say we have an L5S1, pain, or we have some sacroiliac pain.
Lumbar is low, spine, sacrum is the towards your tailbone. We're talking about lower back right here.
Yeah, the spine is resting on the sacrum, and then you get the tailbone. So there are acupuncture points related to the sacral foramen, the holes where the nerves come out from the spinal cord through the sacrum, the holes where the nerves come out at the vertebrae, the vertebral levels. There are acupuncture points there. And so we can treat problems at levels that we can determine by acupuncture needles. And we also always use what's called a distal point. So when I'm working in the bladder meridian here, I know the flow is from the head down, and I can hook up my little leads. And I also want to make sure that that chi is going to keep on flowing. So I'll use a point at the back of the calf to pull it all the way through the low back. I don't want things getting stuck. I want them to flow. So that's the kind of thinking that we use when we're doing acupuncture treatment. What's going to improve flow?
Okay.
Okay?
Mm-hmm.
So that's how we do that. That's how I would treat a low back. If I know, say, somebody's had a surgery at a particular level and they're having some pain or whatever, then I can treat that level. I can treat levels where there are osteopathic diagnosed problems. And then we could talk about things like how you would treat hypertension.
That's high blood pressure.
That's getting into the internal medicine.
Internal medicine. Okay, well, let's jump around. So let me just summarize this. Somebody calls you up, Dr. Overkamp. I've got low back pain. You could see them. And on the initial visit, you could give them a treatment. Mm-hmm. It would involve perhaps a needle in all four of the gates and in the lower back. So someone would come in. Would they get half naked or in a gown or something?
Normally,
lie on a table. Describe the process.
Okay, so if we're going to be treating the low back, maybe the pants need to come down a little bit. But normally, we're treating arms and legs, elbows, to hands, knees to feet.
Is someone lying on a table? Are they sitting? Are they seated in a comfy chair?
Be.
How would you treat? Gil comes in for low back pain. How are you going to? I want to envision the actual process. Tell me what is the nuts and bolts of how it happens.
So first, I say, "Hey, Gil, are you interested in some acupuncture?" Because some people don't want it. And if they say they're afraid of needles, I demonstrate on myself.
Here you go. Dispel myth number one.
And I explain that this is not a hypodermic like I already have. But then if you say yes, then I'll say, okay, let's just make it so that your shirt can come up maybe to your waist. And maybe if you have real low back, maybe your shorts can come down, to those sacral
so you're not
temples.
Getting naked in a cold table with a gown
and we're
on.
Very warm in the acupuncture room. We have heaters in there. We have TDP lamps that are far infrared that keep you warm.
So you don't have to get into a dreaded medical gown with your bottom hanging out. Believe it or not, people are afraid of that. Right? It's like, I don't want to do that.
I can do acupuncture with a patient in the dreaded medical gown, but most people are more comfortable in their clothing.
Right. So you can come in, we can just expose the lower back. Now, would they get on an exam table?
I have a comfortable table. So exam tables have varying degrees of comfort. I have two tables. My cranial table is very comfortable for acupuncture, and it's extra wide.
And would they be on their tummy face down because you got to get to the back?
Yes. If we're doing low back, they would be on their tummy, and then we would be giving them pillows and a bolster for their feet so that their toes aren't crunched.
So they're comfortable. They're not naked. It's not going to be painful.
Pick what kind of music they want to listen to.
Oh, they can pick some music. I love it. And then you apply these needles.
I apply the needles, and I talk to the patient. If it's their very first time and their very first needle, I'll say, did you feel it? And I just want them to know I care about what's happening while they're getting their needles in. When they're used to me and they're used to acupuncture, they'll spontaneously give me feedback. Wow, that one is really zingy today. And I'll say, good, let me know if that's not gone in 30 seconds. Okay. Because occasionally we need to reposition a needle.
Okay.
That happens maybe once every 4 or 5 months.
Oh, so it's far less than 1%.
Far less than 1%.
0.001%. Okay. All right. And then how long does the session last?
Normally it lasts until the needles are done. You can feel. You can feel.
How can a busy doctor schedule that?
It's usually about 30 minutes,
About a
depending
half
on the
hour.
person. If I have a sick person who is being treated for pneumonia medically, okay, so if it's bacterial pneumonia, they're on an antibiotic and they're getting acupuncture. They might be on the table for quite a while, but I can run 2, 3.
All right, so you get them
acupuncture
set up,
rooms
they're
at
comfy.
once. Yeah.
You can go see the sick
See the
child,
next person.
the
Yeah.
whomever. So your
Right.
flow. So you don't have to charge $1,000 a session for these people
No.
you're able to spread out your productivity here.
Correct.
You know, I'm a private practice doctor, and I have to. You have to produce. You can't, and you have to schedule other people. You can't just say,
That's right.
"Well, if Mrs. Smith's going to take 2 hours for her acupuncture today, it
Not
messes
so
up your day."
much.
There's 20 people in the waiting room.
Yeah, somebody that I think is going to need a long session goes toward the end of the day.
Yeah,
Then I
yeah,
can
yeah, yeah.
give them the time they need and see maybe the last patient. Meanwhile, either I or somebody else is going and doing a quick check. Hi, how are you? And all my patients get a doorbell. And if they
doorbell. You
become
go, ding, ding.
uncomfortable, they ring the doorbell and we come in and find out what they need.
Love it.
Most
Love
of them,
it.
they just want to say, hey, the needles fell out. I'm like, no worries. But occasionally they'll say, you know, I think the lamp is a little too warm or I'm getting too cool or something like that.
All
And
right.
just help
So it
them.
would be roughly about a half an hour.
It's about a half an hour for the acupuncture. I need to talk to them first, so that's a little bit more time.
Boy, this is not a 6-minute HMO quick
No.
checkup visit.
Follow-up patient is 10 minutes, catch me up on what's happening. Often I can put them on the table while they're catching me up and
Okay.
start the acupuncture treatment.
Okay.
It takes about 10 minutes to put the needles in and hook up the electroacupuncture for doing that.
Okay,
And
so
position the lamps.
for back pain, will you sometimes clip on a little electricity, a little micro amperage?
Yes.
And what does that feel like?
It feels like a little buzz.
A little bit, so you can feel it.
Yes, most people, if they can tolerate, I'll say, you want it to be strong but not painful.
Okay.
And then I'll say, I'll start to turn it up and I'll say, tell me when you first feel it. And then tell me when it's too much and I'll turn it down a bit. And then when it's there, they can feel it, but it's not painful. I'll say, is that okay? They'll say yes or no. It could be stronger. It needs to be turned down more.
Okay. So that's a typical treatment of lower back pain.
Mm-hmm.
Go on. What are these thousands of things you can treat? Give me another one, maybe a slightly different category. That you mentioned
Let's do
high blood
pressure.
All right, talk about it. Huge. Now, folks, I couldn't think of a bigger jump. One's kind of musculoskeletal. One you think of as an internal medicine thing.
Right.
Kidneys, and in fact, I have a doctor lined up to do high blood pressure. He's a kidney doctor.
Oh.
Kidney doctors also do a lot of high blood pressure. So here you are, a doctor with many skills, including acupuncture, and you can address high blood pressure.
I can, and to be a good doctor, I want to make sure it's what we call essential hypertension. That is, it's not being caused by renal artery stenosis or some other zebra.
Yeah,
Cause of high
that
blood
folks,
pressure.
that's when there's an actual blockage or tightening of the artery going into your kidney. It sees low blood pressure, it wants to react and increase the blood pressure, and you're not going to get around that with, you got to fix that block. I mean,
Right.
you got to do something.
We can support kidney chi while Western medicine is doing its cool thing.
Yeah.
So there's a lot of ways that acupuncture can be adjunctive to Western medicine.
Mm-hmm.
And I will say, in terms of essential hypertension, which is the ordinary diagnosis that people come to me with when they have high blood pressure, they're already on medication.
Sure.
And so I ask them, what would you like to do? Well, I'm on one medication, I'm completely controlled. This is a patient who might be able to come off their medication. I don't suggest that to them because they're going to need to stay on their medication while we begin to treat alternatively.
Right. There's a
But-
transition. It's not like you're going to flip a
Oh, no.
switch. It's
No.
going to be slow.
But I do tell them, expect this to work. I also do functional medicine, so I'm going to be doing, diet with them. I'm going to be doing nutrition, doing acupuncture. And I'll ask them, expect it to work. What does it feel like to you when your blood pressure is low? And I'll see if they have hypotensive awareness. If they do, great, I can treat them because they start getting any sign that their blood pressure is too low. That's dangerous. And we would want to back off and not be plunging them into hypotension.
So that requires some self-knowledge, some introspection, some insight.
Right.
And I know when something's hot and something's cold or something's painful. What does that sensation, I don't even know what to call it. How can you feel that your blood pressure is low?
Usually the first thing you notice is some lethargy. You just don't want to get up and do something like that.
Low energy.
I discuss that with the patient and I say, if you feel this, do not take your antihypertensive and call me. Okay? I want to know that they're having this issue. And I also have them taking their blood pressure.
So they'll have a blood pressure machine. They'll be instructed on how to do that.
Right.
So they can, once again, require some intelligence and some, self-awareness and some motivation to do that.
Yes. So what's surprising to most people who aren't really aware of diagnostics in Chinese medicine is that what I'm going to be treating is the liver qi in almost everybody who has essential hypertension. I'm going to be treating the liver qi.
And the liver everybody controls everything in metabolism.
It does.
It really does.
And the liver qi, the liver meridian contains the liver qi, the eyes are in the liver qi.
I'll be darned.
All kinds of things are related to the liver qi. So when I talk to people about their qi or the meridians, I make sure to tell them, if I'm treating the heart meridian, that doesn't mean that you have heart disease. It doesn't mean that you have liver disease from a Western standpoint. It means that that qi flow, which contains the heart or contains the liver, is part of what's being blocked in the case of hypertension. The liver qi is either blocked or it's rapidly ascending. The liver qi is supposed to stay near the belt. It's not supposed to rush up. So we treat the liver qi also for hot flashes.
Ah!
Right? This is rapidly ascending liver qi. It's like I said, it's supposed to stay at the belt level.
So I'm not trying to drum. I am trying to drum up business for you. So let me say, yeah. So if a woman has hot flashes, there's another condition you can help.
Yes.
With acupuncture.
And again, I would be treating the liver qi. I would treat other things too. How would I know? Well, I've got their Western symptoms. They've been diagnosed or being treated. But they're also, so we take the pulse. But we don't
and you
take
do that
the
a special
pulse.
way, don't you?
Yeah.
Just 3 fingers.
Three fingers.
Yeah.
3 deep, 3 shallow. On the radial artery on both sides gives me 12 pulses that I'm listening to.
Oh,
okay.
Yeah.
And let's see, Gil. Let's see.
Yeah. This is real, folks.
So Gil is buff. He's fit. And there's
Thank you.
some muscle tissue to get through to get to his radial artery. There we go. Okay. And this is the left side. So on this side, deep, the kidney qi is good. The heart qi is a little low.
Okay.
That doesn't necessarily mean there's anything here to fix, okay? And then if I go superficial, the small intestine qi, which is paired with the heart, it's strong. So that's good, okay?
All right.
And the spleen qi, it's not slippery. So, Gil, you haven't been eating a lot of ice cream lately, or have you?
Not a lot of. I had 2 bites a couple days ago.
Are you much on refined carbs?
I have good days and bad days. I try to keep them down.
Stick your tongue out. Tongue diagnosis is the other. Okay. Very little spleen damp. Eating refined carbs causes spleen damp. You just have a couple indentions on your tongue, and I'm not feeling it in the pulse per se, but I can see it on the tongue.
I am so fascinated. I am just blown away. And I, there are stories of people making incredible diagnoses with this. This is not hocus pocus, folks. Oh man, that's so exciting. Well, I'm just going to tell you right now, you're coming back. We're talking about other stuff. As much as I want to go on all these tangents, and I'd love to be your guinea pig, your subject here. So we talked about acupuncture for pain, musculoskeletal. We've talked about it for high blood pressure, which in the Western world we would put in the camp of internal medicine. Mm-hmm. You do things that would be in the world of psychiatry. Mood, addiction.
Yes.
I see so much anxiety and depression. Oh my goodness. The majority of my patients in the fertility world, anxiety and depression.
Yes.
Give me a taste, give me a flavor of what types of things you can address with acupuncture.
Okay.
In more of the psychiatric world.
And real quick, I forgot to mention
Please.
that infertility is a great indication for acupuncture, and especially for Qigong and acupuncture for both partners.
So, well, let's just open a highway from my office to yours. Oh, I love it. I love it.
So mood disorders or outright mental illness. First, I would look at the physical. I would look at exactly what we've just been doing. Are the meridians flowing? Does the patient have Western diagnoses that are non-psych diagnoses? Is there vitality? Your vitality in your kidney chi was good. Okay,
I love it.
Strong.
You just build me up.
So I can feel this. Okay, if it's low, as it is in many people, then kidney is associated with the emotion fear. So I want to treat that because anxiety, right?
Is fear.
Yeah,
for lack
anxiety
of a better
is
word.
fear that lasts longer than 60 seconds, And it could be focused or not focused. So if a person has kind of global anxiety.
General anxiety disorder.
There's a lot of things that we do with them, and particularly working with the gut, and that's my functional medicine. But we also support that with acupuncture.
What would you do with needles for anxiety? Where's the anxiety meridian?
And there isn't an anxiety meridian, right. But there are points that are associated. So, for example, because the autonomic nervous system has two sides, sympathetic and parasympathetic, we'd want to downgrade the sympathetic side and upgrade the parasympathetic side because the sympathetic is that fight or flight.
Fight or flight.
Bring it down.
So this is this turned way up in these anxious people.
The gut. I told my Chinese acupuncture doctor one day, I have thyroid disease. He said, in China, we don't treat the thyroid, we treat the gut. And now with all we know about autoimmunity and gut health and all that, it makes perfect sense.
I see so much obesity and hypothyroidism.
Yes.
Low thyroid.
So, yes, we absolutely can address these things. Points that I would use, for example, if somebody had anxiety, I actually would manipulate their ileocecal valve to kind of calm down the gut and allow you can't digest when you're in hypersympathetic tone and anxious all the time.
The ileocecal valve, folks, is where the small bowel meets the large bowel, right down here.
And if we can close that, because the valves open under stress. You don't digest when you're under stress. because you don't need to digest anything.
Because you're fighting and flighting.
Keep yourself
you're
alive
running
for
away.
the next 60 seconds. You don't need to digest anything. You're going to sink or swim based on what's already available to you. So the valves just open. So we shut them. We do that. And then I look in the pulse and tongue diagnosis for where in the gut is there an issue. And then I can identify that and treat those points. Treat those meridians.
It's more of an indirect, it may seem circuitous going around the bend, but that's how you kind of put a
and for psychosis,
spot on it.
We use what are called ghost points.
Oh, I love that. Ghost points.
Isn't that strange?
Oh, I love it. I love that name.
Because the Chinese, way back, and maybe still, I don't know, in some quarters, believe that mental illness is caused by what they call hungry ghosts that are invasive.
What a perfect analogy. I love hungry ghosts.
So
I'm going to take that one home.
what we're going to do is help people with these points that are effective for psychotic issues.
I'm writing that one down so I don't forget. Hungry ghosts.
Hungry ghosts.
Oh, it's perfect. I can see it. I can feel it. I can intuitively apply that analogy to a mental illness.
So it's a great honor and privilege to be a physician, to help a person optimize their physical and mental health so they can be who they're meant to be, so they can fulfill their purposes here and have the happiness that comes from optimizing who they are for their own benefit and the benefit of other people. It's a sacred mission. I love it.
Yeah.
It is so fun and so rewarding.
And so rewarding. It
is.
Really is. It gives meaning and purpose, helping others, and you have these tools. So, Sue, we're getting near an hour here. And, can we talk about maybe some more common conditions that you can treat with acupuncture? Someone can call you up at door-to-door medicine and say, I have this. Can you help me with acupuncture?
I like to treat viral illnesses because we.
Wait a minute. This is you're coming in every different angle here. Now you're saying
cold, right?
You can help a viral illness with acupuncture.
Sure.
I want to hear more.
So there are no medications approved for colds except for one, ipratropium spray, nasal spray. But other than that, there's no medications approved by the FDA for colds. That said, if there's something over the counter that helps you, buy it, use it.
Sure.
But we don't have medications to pinpoint adenovirus for a cold or coronavirus for a cold or whatever, rhinovirus.
Rhino.
But we can boost the immune system with acupuncture.
With needles.
Yeah. Yes.
Explain.
Okay.
How can this little needle affect a viral illness? Give me a chain of events here.
Okay. So
causality is called.
If a person is frankly ill from a cold, then their immune system has kind of not quite functioned optimally.
Yeah, they've escaped. They've started dividing.
There's a little deficiency, right, in their immune system. And that's seeing it from a Western perspective.
Because let's make this clear. We have viruses and bacteria in us all the time. So there is this balance in our immune systems all the time. And we have to have this balance between, we've evolved with these things. If we were in a sterile environment, we would not be healthy. Right. All right, so I just wanted to just lay that foundation.
And because we don't have good medicines for most viral illnesses, it's great to be able to use the needles to boost the life force related to the immune system and to remove any blockages that are causing a disruption in the flow of qi. Think how you feel when you have a cold or bad allergies. It's like you're wrapped in cotton wool. There's all this pressure. What is pressure but a block That's what the pressure. So here go the needles. Here go the needles. Here go the needles. Needles, 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 needles.
Well, that makes a lot of sense now.
Okay.
Okay.
So
okay.
large intestine meridian, bladder meridian, and triple burner, which is directly related to the immune system. Yeah, and I always tell people, the large intestine is the body's trash can.
Yeah.
Take good care of it, because if you don't, you get trash overflowing. Now it's backing up. Now the kidney is having to work harder. The lung has to work harder. Take care of the large intestine. These are large intestine points we've been talking about.
You may be old enough to remember the comedian George Carlin, one of the funniest human beings ever to exist on this planet.
Yes.
He had jokes about his colon. It's going to come, about his immune system. He said it's going to go in my body and out my colon, he would say. And he would stay healthy. He was talking about staying healthy. So even he knew the importance of the colon.
Yep. So, if the colon chi is low, okay, let's take care of it. Right now, mine's good. And my lung chi is a little squirrely. So I would treat my lung chi, which is partner with colon. Nose is the external opening of the lung. So for a cold, I put a needle at a control point for the lung meridian. It's here in the wrist. And then I treat the sinuses directly. And then when the needles are out, then we do massage.
The drainage and the symptoms and the immune return, the flow. I could see now. I can see a mechanistic and actually, something maybe we Westerners could understand. Now I can see the mechanisms by which this would work. So fascinating. That is entirely believable. There's nothing magical about that at all. It's
not woo-woo.
It's not woo-woo.
It's something that's worked for thousands and thousands and thousands of years.
Wow.
And we love new science. We love what we're learning. They're learning in China like we are in the West through science, right? That's cool. That's good. And what has worked for thousands of years is also cool. And to be able to marry them and to use them both, it's awesome, because nothing is the perfect fit for each person in each visit. Mm-hmm. There's not just one thing that works.
And that's where a practitioner like you with these many, let's call them skill sets and ability and an integration of all these things together, I find very exciting. And I've got a feeling I'm going to beat your door down for a personal visit someday. I'd like to learn more about myself and what I can do. I turned 63 today.
Happy
63
birthday.
today, and this feels like what people say. Oh, it's your birthday. You don't want to do this. No, this gives me such great joy to be able to do this on my birthday and to learn more about you. Incredibly rewarding and exciting to learn about this, and I think I'm going to give myself the gift, if I can, sometime, Sue, to make an appointment to come see you and learn more about my systems, because I do what I can to stay healthy, but I too will eat that ice cream or the things that are not good for me. And I have struggled with my weight for a long time, and I could certainly do things to tune up my health so that I can be of service and be productive and help other people in my life.
It would be an honor and a privilege to work with you, Gil, just as it is here. And the other thing guaranteed, it'll be fun.
It'll be fun.
We'll have a good time.
Yeah.
Have a good time with my patients.
Yeah, I do that too. When I see patients, because I'm a fertility doctor, they're so nervous because now we're dealing with sex and privacy and
things that our hearts are so set on.
So
it's very tender.
So I throw but I throw jokes around too. It's kind of my way of breaking the ice, let's say, and I say, look, we can be miserable or we can have fun doing what we need to do.
Right.
And you clearly understand that as well. Well, Sue, what a delightful discussion we've had about acupuncture. What a wonderful kind of insight into the other modalities. We now know that there's 3 other things that the Chinese consider even more powerful. So if they're more powerful than acupuncture, my goodness, I would love to learn about all of them. So I want to also tell my our listeners that you just flew back from Europe.
I did.
You're jet lagged. Been in France and Ireland, and when I texted you yesterday, I'm going, "Oh my goodness, is she going to be up to this?" And you have so graciously volunteered your time to come on the show and talk to us about acupuncture. What a pleasure it has been talking to you. Thank you for your educational tools here and your examples of acupuncture. And I look forward to chatting with you about other topics in the near future.
You know, Gil, I'm just going to say really quick, I'm a Tai Chi and Qigong teacher. And I am teaching Tai Chi and Qigong and applied kinesiology coming up here. So if anybody's interested, yeah.
I still remember some of the
Oh,
forms.
look at you. You're a young stylist.
Oh, I was taught Mr.
Right?
Mr.
Yeah.
Ju taught me. He was from Taiwan.
Yeah, this is young style.
Young style.
I'm a Chun stylist.
Oh,
Yeah.
yes. I remember this. A few of these young neurons I learned. So, well,
right.
this could go on and on forever. So, thank you
Thanks
again
for
for talking to us today. And I look forward to doing this again in the future. And once again, may your new practice, door-to-door medicine in Columbia, Missouri, take off and flourish.
Thank you. I know it will. Thanks, Gil.
Thank you, my friend.